This segment of Delmarva Life is brought to you by Peninsula Home Care.
We look at our home as our safe haven, our sanctuary, where we can go to heal, hope, and be happy. But it's not always that way.
For the elderly, for example, being home alone can lead to a variety of emotions, ranging from the fear of loneliness to forgetting things to losing independence. And it's almost as painful and difficult for the family, fearing for the well-being of that individual.
But there's a simple solution: home care. And as 2013 comes to a close and we embark on a new year, now seems like the perfect time to look forward. Here to help us do that is Nancy Bagwell, the Peninsula Home Care Branch Director in Salisbury. Nancy, thanks for joining us this
Thanks
afternoon.
for having us.
There has been a change in the approach to home care, hasn't there?
There really has been. It's been an exciting time in 2013 going into 2014. We have a patient-centered medical home model that many will be hearing about more as the year evolves. It's a more direct approach, direct communication between healthcare providers that's taking a look at improving healthcare outcomes and reducing cost.
So the patient takes a more active.
They do. We are asking them to actually participate in some of their planning for their care, and then we are looking at all the needs of the patient versus just treatment, more of a preventive and education type role.
Why is that important for the patient to take that active role?
It's important for them because they need tools and resources to manage their health and to deal with their health and to try to reduce redundancies and be more proactive in their plan of care so that they can communicate. And
So when you say redundancies, you mean like doing the same test for a bunch of different people?
correct. In the patient-centered medical home model and the new things that we have coming out in 2014, you'll be having access to different types of tools that will help us communicate better, along with their caregivers and their other care providers such as specialists. So we'll know to reduce those redundancies, test.
So there are programs that are available that can make that happen.
Actually, there are. We are working and partnering with MAC, which is our local area agency on aging, to provide chronic disease self-management courses. These will offer people in our area tools and resources to better manage their lifestyle and to be more informed and empowered to make decisions about their health care. These classes or courses and workshops are being offered free to the community.
Now, what about making sure that everyone who's involved with the patient's care is on the same page?
Well, one exciting thing that's happening in 2014 is we are moving towards an electronic health record. And we are looking to partner with Peninsula Regional Medical Center to do that. And what will happen is you, as a patient, will be able to go online and see lab results, change demographic information, maybe ask questions. And then as providers, we will be able to communicate with each other. We'll be looking at notes and treatments we provided. We'll be able to reconcile medications, make sure you're taking appropriate doses, and that we're not issuing the same things more than once to you.
And telehealth is about to go live. What is telehealth?
Telehealth is an excellent tool that we like to use in the home. It provides information, so you come home from the hospital, you're used to being monitored very closely, and then you're sort of on your own. This offers not to replace the visits that we make as providers in the home, but to actually enhance it and be tools. You can measure your weight, look at your blood pressure. We can see important statistics that would indicate that there was a need for a visit from a nurse that would reduce rehospitalizations, reduce emergency room visits, that sort of thing.
Nancy, that truly is exciting. A lot of good things coming up in the new year. Thank you for filling us in on
Thanks for
all
having
of that.
We'll talk to you.
And of course, if you would like to learn more about Peninsula Home Care, go to our website, delmarvalife.com, and click on the show tab.